In this question, we have a 22-year-old woman who presents with 2 witnessed episodes of loss of consciousness, described as 10-minute tonic-clonic seizures. Her neurological examination is normal, and she also has a family history of epilepsy. The question is asking us which anti-epileptic medication is most appropriate. Give a moment, pause, answer, and then replay the video. So the key details in this stem are that these are generalized tonic-clonic seizures and that the patient is a woman of reproductive age. So the correct answer here would be lamotrigine. And we'll select that option and submit the answer. And there's an explanation down here, but we'll break it down as well. So lamotrigine is a broad spectrum anti-epileptic medication that works by blocking sodium channels. It is considered first line for generalized tonic-clonic seizures in women of childbearing age. Current Australian guidelines recommend lamotrigine because it has a much safer pregnancy profile compared to many of the other anti-epileptic drugs and is associated with a lower risk of major congenital malformation and therefore is preferred in young women of reproductive age. So now sodium valproate is an important option. Valproate is actually very effective for generalized seizures, but it is strongly avoided in women of reproductive age. And that is because it is associated with high risk of neural tube defects as well as long-term neurodevelopmental problems such as intellectual disability and autism spectrum disorder in children. So in Australia, the use of valproate in women is heavily restricted and requires formal counseling and pregnancy prevention programs. Because of this, valproate is not the correct answer in this scenario. Phenytoin is another option here. So phenytoin is another sodium channel blocker that can be used for tonic-clonic seizures. This is used particularly in acute settings such as status epilepticus. However, due to the teratogenic risk, phenytoin is not preferred as a long-term therapy in a young woman. Carbamazepine is another sodium channel blocker, but it is primarily used for focal seizures rather than generalized epilepsies. It can actually worsen generalized seizure disorders and is also associated with an increased risk of congenital abnormalities. And for these reasons, it is not appropriate for our patient here. Ethosuximide, the final option here, is a drug of choice for absence seizures, but it does not treat generalized tonic-clonic seizures. Since this patient doesn't have absence seizures, ethosuximide is an incorrect option here. So I hope you guys gathered something from this explanation. The key takeaway here is that we've got a young woman with generalized tonic-clonic seizures. Lamotrigine would be the most appropriate first-line anti-epileptic medication, whilst valproate and the other alternatives should be avoided in long-term use of women in reproductive age. If you guys want to see or practice more questions such as these, check out the ACE exam website. There's thousands of questions on there. Links in our bio.